Good evening. My name is Kezia Clark, and I'm a senior at the college, zooming in from Hyde Park, New York. Welcome to our final week of Fast Forums, our virtual series featuring conversations with prominent public figures, including elected officials, journalists, and activists. While we cannot join together in person, technology allows us to convene virtually, and bringing Fast Forums online allows us to share Harvard University's premier arena for political speech, discussion, and debate across many states and countries while we are remote for the remainder of the semester. Now, please join me in welcoming our guests, Mayor Sumbul Siddiqui and Belfer Center's Aditi Kumar.
Thank you so much, Kezia. It's a pleasure for me to be here, and thank you to everybody who tuned in to this FAST forum. We are pleased today to welcome Mayor Sumbul Siddiqui, who is currently serving her second term on the Cambridge City Council and first as mayor of Cambridge. I've known Mayor Siddiqui since her first term on City Council as an advocate for the city's most vulnerable populations. She has fought for affordable housing, for equitable access to education, and promoting racial justice. Mayor Siddiqui immigrated to the United States from Pakistan with her family when she was 2. She was raised right here in Cambridge and is a proud graduate of Cambridge Ring and Latin, Brown University, where she got her her bachelor's in public policy, and Northwestern's Pritzker School of Law. Welcome, Mayor Siddiqui. It's so nice to have you.
Great to be here.
So, Mayor, as attention shifts to how we begin to reopen Cambridge and reopen the country, my first question is, can you help us understand what decision-making powers the mayor and the city council have relative to other decision makers? And, the three that come to mind are, of course, Governor Baker and state officials, the presidents of Harvard and MIT who are making decisions about whether we open these universities in the fall, as well as the superintendent of schools and the school board, who are presumably making the same decisions about Cambridge public schools. So how closely synced have you been with these stakeholders to date, and how do you envision working with them to reopen?
Sure. So throughout this process, it's been constant communication and collaboration with especially our state representatives and our federal representatives. And on the local level, the role of the council and my role, we set the policy and we appoint the city manager, to carry out different policies. This pandemic has been one of those situations where we are constantly having to make decisions, and my role has been much more closely aligned with working with the city manager on a daily basis on some of these important decisions that we've had to make since March 11th. And so there's still, the city council is playing a role, but because we're in a pandemic, we've had to adapt, and consequently my role has, I've had, much more active involvement in many of the decisions that, have to be made day to day. And that starts with when the decision of closing schools came, the city manager and I were at a big meeting along with other mayors and managers across the Commonwealth. And we were hearing data that basically was telling us, all right, then the next step is to close schools. So then we had a conversation with the superintendent and said, this is what we need to be doing. And it's been a lot of collective decision making in that sense. And so that's been, sometimes that is challenging because not everyone may be in the same place at first, but that has been something unique in this situation. If someone is not agreeing about a certain policy, we've had to quickly shift and say, well, you know what, we're going to close the parks. We will close, we have to shut down the tennis courts. We'll have to, we're not going to have any meetings. We have to close City Hall to the public. It's been a lot of rapid adaptive policymaking, and that's really been informed by our state representatives too, who have close ties with the governor And we have a lot of weekly calls with the Metro Mayors Coalition that meets, virtually every few days, I'd say. And so we are working with Somerville, working with Malden, we're working with Boston. We're really working. It's been a really regional partnership.
Mm-hmm. And what are some of the lessons that you take away from this in terms of dealing with the next crisis? Is this the right diffusion of responsibilities? And do we have the right decision-making processes across local, state, national, and non-government or private sector actors?
I think one thing that's been hard is sometimes there hasn't been, I think the guidance that municipalities may need. It hasn't come right away from the state government and the governor, and so that's been something that I think if there's another pandemic, I think just being more on the same page with the state, and I think when the governor comes on, he's making these decisions, and often it's felt like as a municipality, it would have been great to know some of these dates and other things a little prior to, and have a little bit more coordination in that sense, because some of the cities have said, okay, we have to move on this if the governor doesn't come out, soon enough. And so there's been a little bit of that, and I think I think the governor and lieutenant governor we've had a lot of constant communication with the lieutenant governor about some of the synergy and making it much more collaborative than it has been. So I think in the future, I think that's something that I think there's some lessons to be learned.
Got it. As you can see in the chat, in true forum tradition, we do want to take questions from the audience. So maybe I'll just ask one or two more, and then open it up. And please think of smart questions for the mayor while we have her here, and we'll let you into the room to ask your questions. So, Mayor, another thing I wanted to ask about is, Cambridge is in a unique position because it's home to a thriving biotech sector. How have you thought about leveraging the expertise of some of our local companies to address the COVID-19 crisis?
Yeah, I think we are in a hugely unique, market with our biotech industry and our, universities and so forth. And I think we've been able to have some effective partnerships. I think right off the bat, many companies, Novartis, others, said, here's, PPE that the nursing homes can have, that the hospitals can have, and those partnerships really started right away. Same with Harvard and MIT. They said, how can we help? And so that was, really, we didn't even have to ask. That's been a very important thing. I think, what we've seen is some of the, we have the Broad Institute who stepped up and said, look, we're going to convert one of our labs to be a testing facility. And that way, we were able to test our nursing homes and our homeless population. 4 weeks to 5 weeks ago, we didn't know that was even a possibility, but that's something that has come from the fact that the Broad Institute is in Cambridge. And so there's been, I think there's other partnerships that we are thinking of. I think it's more of just been like what is available. And some, we have Moderna here they're working on a vaccine, right? There's some of these companies are actually doing a lot of COVID-19 related work that's not going to only help Cambridge, but hopefully the rest of the world. And then there's these other ways that the biotech companies have stepped up. And that includes a lot of, monetary contribution. Takeda donated $2 million to the Mayor's Fund. Biogen donated $1 million. So we have these other companies stepping up, and this money goes directly to the residents who need it the most.
Great. And what about some of the local businesses? I mean, those of us who spend or used to spend time in Harvard Square just saw business after business shutter even before COVID-19. And the crisis will undoubtedly exacerbate the financial strain. So, what is the city's plan to support some of our local businesses?
Yeah, that's a great question. We'll have an announcement next week about a fund it's going to come through my fund, help in conjunction with the Cambridge Redevelopment Authority. And these will be large grants that we will be helping some of our businesses with. But that's not enough. I think what we're looking at, we just actually today announced a small business advisory group to help with planning and reopening some of our businesses. And so, we have a long way to go. I think unfortunately, there will be businesses that will not be able to survive. And we already are hearing from some of them who said, I don't think I'm going to be able to come back from this. And that's, it's just, some of these are just mom and pops, and it's really unfortunate. And so now I think the thinking is shifting to, we can give these grants. We already had a $6,000 grant program that has been going on, that we've been getting some of these monies to support these small businesses and their employees and payroll and so forth. But it simply is not enough. And so, as a city, what are things that we can think about? Is it fees that we can forego? Is it, if they're going to reopen, make sure there's no inspection involved, right? How do we make it as easy as possible for these businesses to come back? But it's quite a challenge. It's something that we are thinking about, and we have to be really nimble and flexible with if we want our main streets back.
Right. Thank you. I'll open it up to questions. I think all the students know the drill. When you come on, please identify yourself to the mayor, tell her a little bit about yourself, and please ask a brief question. And please make sure it ends with a question mark. So I'll take the first question from Ara, who's an undergraduate student leader from the IOP. Go ahead, Ara.
Hi, thank you so much again for speaking at this forum today. I honestly just had a question about inclusivity. So I'm an undergraduate, I'm a sophomore, I study government and then global health policy. So something like this is a case study, but kind of happening in real life. And I just wanted to circle back to the more vulnerable populations that are throughout the United States, but then also within the city of Cambridge, which is a microcosm in a lot of ways of the United States. So I wanted to ask just about the measures that you could see the city taking to take into account, not just small businesses, which will impact the economy, but also African-American populations or immigrant populations where people who have undocumented status are also, even though Cambridge is a sanctuary city, seeing that they're interacting with ICE in the same vein as they're trying to get healthcare. And I was wondering just what you see as the mayor, how your impact could kind of quell these problems.
Yeah, so I think it's all about, thinking about how we're reaching our most vulnerable. And if we're not, why aren't we? And I think some of the things, it comes down to thinking about how our city resources are available in, a variety of languages. An example, I have is with the Mayor's Fund. We were getting all the application process going, everything. And I said, if we really want to reach the people who this fund, wants to help, we have to make sure that access is easier. So we right away set up a hotline to provide support, application support in various languages, Amharic, Arabic, Bangla, Chinese, there's Haitian Creole, Hindi, Portuguese, Spanish. We got volunteers ready to go to make sure that we were here, getting that help. When we think about even how we were with PPE and making sure our multifamily unit buildings that have very diverse populations, how they've had access to PPE. Our police, our Cambridge Public Police has been partnering with us to deliver PPE to the most vulnerable populations across the city. And when you think about education, that's a huge, huge issue that for me, right off the bat, we knew our schools have such a population that is on free or reduced lunch. So we set up these emergency meals that we've been able to, in that first month, to deliver 10,000 meals at 8 different food distribution sites. And then that goes to other examples. There's so many families who don't have internet at home, right? So we said, we can easily get Chromebooks, we can get hotspots to these families, over 400 hotspots, over 400 Chromebooks, things that we could have actually done before, but we didn't. But here, because of crises, we've said, okay, we have to get all these things to the most vulnerable. But I think this has also been a lesson in there's so much we could have been doing before to meet these needs of the most vulnerable, but we're doing it now because it's it's a pandemic. But I think it's also opened our eyes into just how insecure and insecure some of our vulnerable populations are, and the role that local government can and should play. So, Amy, I think that's a kind of a broad way to answer your question, but I think it's always thinking about our most vulnerable and how we're reaching them. So,
thank you.
Thanks, Sarah. Next, we have JD. JD, go ahead. JD, you may be on mute.
Hi.
Hi there.
Thanks for coming on and speaking with us, Mayor. I'm wondering mostly about the general election in November. We've seen a lot of calls for like a switch to paper ballots only and just doing absentee voting. I'm wondering what role local governments are going to be playing in this, and if you can speak to that a little bit.
Yeah, I think right now this is a decision up to the state legislature, and we have been called on by folks organizing to sign on to letters, to do vote by mail and so forth. And I think depending on what happens and what the governor decides, that'll impact on the local level what we can do, because the city, the Cambridge Election Commission would need that power to do vote by mail by the state. So our hands are a little bit tied, thinking about November. But I think a lot of us are thinking, if this is something that the governor would be willing to support.
Thank you.
Great. Thanks, JD. Sumbul, I wonder if you can speak a little bit about your own experience and how you got into public service. I mentioned briefly that you immigrated here with your family from Pakistan, grew up in Cambridge, and how did you get into politics, and how have you found your experience so far as mayor?
Yeah, sure. So I, in high school, got involved with the city council, and my friend and I and a few of us, we co-founded a youth council, and that youth council interacted a lot with local government. And one of the first things we worked on was lowering the voting age, or trying to lower the voting age to 17. And we had to go to city council, and we had to go to the chambers, and some of the counselors are still on the city council, so it's a little bit wild. But I just remember going and feeling heard by the mayor and the committee member, the city council. And I said, wow, this seems like a cool job. One day I'd love to do that. And I didn't know how I was going to get there. I had no idea, but I said, that seems cool. And I put that in the back of my head. And I think one of the things I also really cared about was helping people. And so that's why I went to law school. I became a legal aid attorney. And I really wanted to merge my interests in policy and public service together. And for me, elected office, I think I saw that opportunity. And now as mayor and city councilor, I think that role of a policymaker and then having that constituent service piece is exactly, what I wanted to do. And so I feel really fortunate that I can have this platform and be able to do that.
Yeah, it's an inspiring story for our students for sure. Michelle, I think I have you up next. Michelle, go ahead.
Yeah, hi. Thank you so much for taking the time to speak to us. My name is Michelle. I'm a junior at the college, and I'm currently quarantining back home in Michigan, where there has been some resistance to our stay-at-home warning. And so, just kind of out of curiosity, since it's been over a month since I left Cambridge, how have residents there responded to the shelter-in-place orders? And if something like this needs to happen again, are there ways to improve that, improve, safety while also allowing people to, go for a run, do things to promote their physical and mental well-being?
Yeah, I think there's certainly lessons to be learned. I think for the most part, everyone has been very supportive and I think on board with every single policy measure that we've implemented. That's been good. I think there's been, we just implemented this emergency order requiring face coverings. I think a month and a half ago, it was, oh, we don't, I think face coverings will really make a difference. And so even that adaptive process of, okay, well, the verdict is kind of up on this, but we do know that there's many of us who may be carriers and not know, and therefore, let's put this order in place with guidelines. But for me, I struggle with that decision a little bit because I said, we're imposing a fine. We're even saying we're having a fine, but we're really not going to punish people. We really are. We're actually, our police are giving out masks. We have, multiple locations where people are picking up masks. It's a lot. It's more education. So that was it's been a tricky thing of, there's been things that maybe a month and a half ago, we were like, no, we're not going to mandate face coverings, but now we just did. And people are so happy that we did it. Where a few people were like, why did you do it? The science is mixed on this. But even so, we went ahead and said, we better just do it because of there's enough reasons to do it. So that's been an interesting thing. And I think on the open space piece and streets and, Memorial Drive being still closed, I think we have said we're relying on our expert advisory panel that was put together to kind of give us a sense of, what do you think is best as far as, slowly opening up streets, slowing up the Memorial Drive and so forth. And that has felt slow to people. I think people are like, well, where's your plan? Why aren't you opening up Memorial Drive? The surge is over. So again, it's a little bit, it's very day to day. And I think our decisions are impacted day to day. And I think even a month from now, I think looking back, I think there's things that we could have been maybe doing a little bit faster based on the things we know, but it's so speculative sometimes that it's not always easy to have a plan in place that day,
Thanks, Michelle.
Thank you.
Next, we have Emily Rapp. Emily is a mid-career student at the Harvard Kennedy School. Go ahead, Emily.
Hi, Mayor Siddiqui. Thank you so much for taking the time this evening. One question I have for you is this is such an extraordinary, unprecedented time for public servants generally. And I would love to hear more about what has been maybe one of the more challenging aspects of leading through a crisis. I think for public servants is really challenged capacity and in some cases really illuminated gaps in leadership, but in some ways have really allowed public servants to soar. And as a municipal leader, I would just love to hear more about your experience leading through this, what's been challenging, what's been illuminating, what's been surprising about the response from your office or your capabilities or response from other municipal leaders.
So I think one thing that has been, I think the most kind of surprising and also reassuring is the ability for the city to adapt so quickly and be nimble. I use the example of we're like, we need Chromebooks, we need hotspots, we got everything ordered, we got the emergency meals plan in place. There's these things that we've been able to do very quickly. And usually government, and I think my first term as counselor, things felt really slow, or it takes a while to get things moving. And so that's been, I think, the most eye-opening, but also reassuring aspect of it. And I think it's all in the caveat of Cambridge is a very well-resourced city, so we almost have it easy. We have it much easier than our gateway cities and our Chelseas and our Lawrences and our Lowells. And so it is also that fact of, you feel a little bit of sense of we have the resources here, right? We have the resources here. And so as a public servant, it's almost easier to do my job. But you do feel guilty, and you're like, look at all these other cities who do not have much, and they're making do. And I wish we could give some money to these other cities, and have them be okay too, given, you look at who is being impacted, and you look at the statistics and the health disparities that are coming out of some of our other neighboring cities in the Commonwealth. And that's been, I think, one of the most challenging aspects of this. I think we have about 758 cases in Cambridge, and we had about 58 deaths, and 53 as of today, actually. But if you look at other densely similar cities and that are poorer, those numbers are much higher. And so, in leadership, I think that's been something that I've been struggling with. I think our city is going to be okay, and I also am thinking about some of the other cities that aren't. And so I didn't expect that to happen, but I think the disparities are really wide, and you see who is being hospitalized at MGH, and it's just, that is going to be with us for, it's not surprising, right? I have to say that it's not surprising. It all goes back to our, institutional racism, right? And so I think these structural barriers that exist to healthcare, and who is being impacted. So I think that's my broad way of saying it. That's been one of the things that's come up for me during these times, that I feel very lucky to be leading this city. It has been challenging, of course. There's a lot of need in my community too, and I have faith, because of how it's been, the resources in this city, that we'll get through this, and that we will be able to do everything as much as possible for our most vulnerable.
Great, thanks, Emily. Sumbul, we have time for one quick question, so I'll try to keep it simple.
Yeah.
What is the first business you're going to visit once the stay-at-home order is lifted?
Oh, wow, that's a great question. I love Little Donkey in Central Square.
Me too.
So that's my go-to, and so I'll definitely, I'm looking forward to, and going there, and they've been doing great work for the first responders and feeding many, many first responders, and so, but they're not open, but so I can't wait to go there.
That's great. Yeah, I must say it's been heartening to see, as I go to websites for local businesses, a lot of them are doing well and have a lot of support. And I have to get in line for deliveries because they're so in demand. So that's been, been really great. Well, thank you so much, Mayor. And I should also mention that you spent an hour this week with our Kennedy School first year class as well. So thank you for all the time that you spent with our students. And thank you for your service too. And thanks everybody for attending. Let me turn it over to Mark Guerin, the Director of IOP, to close us up here.
Great.
Well, let me just start my video here. And let me thank you, Mayor Siddiqui, for your own public service. What a fascinating conversation. Aditi, thank you so much for moderating so well on our great student questions. We prize your public service and your commitment to it. This wraps up our Fast Forum series, these 30-minute opportunities where we brought together elected officials and activists and journalists. And so we're very grateful to all of you for watching and for participating in these ways. I'm particularly grateful for the Institute of Politics team that have really pivoted very quickly with our student leadership to create these kind of formats. But over the course of these weeks, we've had elected officials like the mayor, Congressman McGovern, a former Speaker of the House, Paul Ryan, journalists like Peter Alexander and Lita Sun and George Stephanopoulos, and activists like Latasha Brown. So they're great conversations, important ones, particularly at this time, but it would not have happened without the leadership of our students. Mari Jones is our IOP president, and Blake Barkley, who's the chair of the Forum Committee, with our team. Kathy Park and Beth Myers and Kelsey Donahue and Morgan Burke teamed up. And it's really been a great program. And it's certainly what we've tried to do across the various programs at the Institute of Politics. So we're profoundly grateful to our students and my colleagues at the Institute of Politics. So stay tuned. Our students now go into reading period and exams, but stay tuned for more opportunities like this. We hope this finds you and all your loved ones safe and healthy. Thanks again, Mayor, for joining us. Good night, everybody.
Thank you.